Okay, welcome everyone to Autism Health's monthly webinar. I am going to just wait a couple of minutes for a couple more people to hop on. Usually, people start to come into the room, and we usually kick off a little bit after we start. So if you feel like you want to get a drink, we will start here in just a minute. Please feel free to say hi in the chat and let us know where you are from. Hey, Kim. Hey, Nancy. Hey, Joe. Kyra. Am I saying that right? Hi, Kyra. Patricia. Elise. I'm so glad that you guys are all here. Welcome, welcome. Patty. Hello, hello. Julian from New Jersey. A lot of people from California. And our guest speaker, Dr. Boles, is from California as well. So that's cool. Wonderful. All right. If you have any questions during the for Dr. Bowles, please feel free to pop them into the chat and also we also have a Q&A bar. So you'll see at the bottom of your screen a little box that says Q&A. That's going to be the most effective way to get your question answered. If you can't find the Q&A box, please feel free to put your question in the chat box, but just make sure you put it in all caps so that it stands out from, if you guys are having a sidebar conversation in the chat, I will be able to see that. Okay, wonderful. Well, I'm going to get us started here. Let's see. I'm going to share. All right. And I just want to tell everybody about our organization. So we are Autism Health. We are a 501c3. And our headline speaker today is Dr. Richard Boles, who is a medical geneticist and a pediatrician who specializes in mitochondrial medicine, functional disease, and autism spectrum disorders. His expertise stems from decades of both clinical work and research at a major academic center, as well as from his most recent experience in the cutting edge biotechnology and genomics. He uses an innovative and integrative approach in both diagnosis and treatment to best serve his patients. Thank you for being here, Dr. Bowles.
Thank you very much. Am I on now?
Nope. A couple more things. We have a lot of events coming up, so I just want to mention them briefly. Like I said before, we are a 501c3 nonprofit organization dedicated to advancing scientific research and improving the health and quality of the life of individuals with ASD and related neurological conditions. Our mission is to fund groundbreaking research, advance education, foster multidisciplinary collaboration, and expand access to trusted resources that empower families, caregivers, and professionals to make informed decisions regarding comprehensive, individualized care by translating scientific discovery into practical application and engaging community leaders and strengthening systems of care for individuals, families, and communities impacted by autism. So we do have a call to action. We believe that anyone can make a difference no matter the size of your contribution. There are several ways that you can help support our organization's mission. If you see the QR code, you can donate financially, volunteering your time, spreading the word of mouth, so powerful, hosting a fundraiser, corporate sponsorships, and becoming a coach or an advocate for a family or parent. We have Cocktails with a Cause coming up in Cosa Mesa, California. Super excited about this event. It's going to be sponsored by Cellular Performance. And it's going to be an evening of, connection, cocktails, and community to support families impacted by autism. And that is at the Park Club, Wednesday, August 5th. If you scan the QR code, you can get details and tickets. Now, this is a very exciting event we have coming up in the winter in Florida. So who doesn't want to go to Florida in the winter? It's our winter gala, and we have some really amazing speakers. We are confirmed with General Michael Flynn and Del Bigtree, also Dave Asprey, and the potential that Bobby Kennedy, well, he's told us that he's going to get back to us. And he said if he doesn't have anything on his calendar, he will be joining us. So that means that if you scan that QR code and you see the price of the tickets, those ticket prices are going to double once Kennedy confirms. So get it now if you're interested. Okay. And then our summit, which is Dr. Boles was one of our speakers. We have the best of the best of people come and talk to us about medicine, advocacy, integrative health. It's 3 days. And the community that you find there is like no other community that you will find in this space, people that actually care about you and your family and what you're going through. So please don't forget to save the date for this amazing event. This is very important. If we have impacted you in any way, your story means a lot to us. So please feel free to email us at info@autism.com or scan the QR code and tell us all about it. We are very interested in any kind of testimonial you have. And then thank you to our incredible community of supporters, advocates, doctors, parents, and caregivers who continue to make a meaningful difference in the lives of individuals with autism. Your dedication, compassion, and tireless efforts are the heart of this movement. Whether you're sharing knowledge, offering support, or simply showing up, you're changing lives and helping to create a more informed, empowered, and beautiful world for all of those impacted by autism. And so it is with my deepest gratitude, I want to say thank you, Dr. Boles, for being here with us today because you are doing just that.
Now it's my cue.
Take it away. Thank
Okay.
you.
I need to send a request to share.
I just received it and accepted it. Do you see the button? Perfect.
Okay, and then this button. So I think the last button I press. Okay, great. Okay, so for those that were at the conference in San Diego less than a month ago, you might recognize some of the slides, but this is a unique presentation. It is not exactly the same, but some of it does overlap. And I'm going to be talking about mitochondria. I'm going to be talking about supplements, and everything, of course, is going to autism. That is what this is about. And then first about who I am. Um, I do many different things, but most of all, I'm a physician that I see patients. And that's what I do half the time now, and I've been seeing patients continuously without interruption, despite other things that I've done now for 35 years or so. Right now, half the patients I see have neurodevelopmental disorders, not all autism. I see ADHD and epilepsy, developmental delay, and everything else on there. And the other half have neurofunctional disorders like chronic fatigue syndrome, irritable bowel, fibromyalgia, migraine, cyclic vomiting, etc. It kind of sounds weird, it's sort of bifurcated, but some of you might recognize those conditions in your family because the underlying genetics that makes autism more likely to occur overlaps a lot with the underlying genetics that makes chronic fatigue and these other things likely to occur. In fact, I started off on the other things, the functional disorders, and then I realized, why does everyone have a brother with autism? It's maybe there's something there, and then autism became a major issue, and it's like, oh, I should really get involved, and that was like a decade and a half ago. Um, I'm also the medical and scientific officer of NeuroNeeds. I am going to be giving you what we call CME talk, which is devoid of any commercial content. But when you see the sharks, then you know that I'm going to be showing you some advertisement. That's at the very end. So wait for the sharks, and then after it's a bit everything before that is going to be what I give to scientific conferences, and it's devoid. Like I said, it tries to treat it without looking at one product over another, and to try to be balanced. You're going to see that I sequence the entire DNA, all 3 billion nucleotides, all 23,000 genes. This is what I do, and in the parents as well. I do that on all of my patients. That's what my practice is about these days. And most geneticists don't do that. I mean, how did I learn to do that? I was medical director of Cortigen for 5 years. I was also at Lineagen and 2 other companies that did DNA. So I started before it was even possible, and we were trying to set up DNA testing for autism, and now we look at the entire DNA. I look at the entire DNA. The last time I looked at a DNA sequence in a patient was yesterday. I do that routinely. Unfortunately, too many of these go to legal cases. Child abuse, neglect, custody battles, and most commonly Munchausen by proxy, or they're saying that you're making it up or something like that. So I do expert witness. And then I'm a researcher as well. I was 20 years at University of Southern California, USC, as faculty. I taught medical school. I taught in the medical school. I trained residents and interns and all that. And I'm still writing papers and autism research and treatment. And I'm going to show you a couple of those to show you that this is really a scientific basis of what's going on. So those that were at the last conference might recognize Emma. And Emma wants her name and her photo and her information there because she wants to show how genetics can make a difference. And Emma was first diagnosed with autism when she was in the first grade with a developmental regression. Oh, I forgot to mention at the very bottom of every slide is that's what I'm trying to say. I've been told many times before that my lectures can be a little complicated. So if you're not wondering, like, what is he trying to say? On the bottom slide, one sentence, almost always one sentence. That's what I'm trying to say most. So in this slide, developmental regression is common in autism. In fact, it's present in about half of my patients. She actually recovered from that and was doing quite well. She was in regular classes, but she had some special ed pull-out. And then 12 years of age, she lost all of her academic skills within a single day. Everyone in the family had a common cold. Everyone just got over the common cold. But Emma lost all of her abilities. She became almost catatonic. She really became like an infant. She couldn't speak. She couldn't walk. It's not only could she not do math, I mean, she couldn't do almost anything. And she had these weird seizure-like events that no one could figure out. She also had functional problems that had pre-existed but became much worse. Migraine that would last for days, pain throughout her entire body, chronic fatigue, and she had an immunodeficiency, severe enough to be treated with IV immunoglobulin, IVIG, and high-dose steroids, and had a diagnosis of CVID, or common variable immunodeficiency. Now, these seizure events, I'm not going to go into the detail, but they were weird with muscle weakness and headache before the seizure-like event, and the EEG never showed any seizure activity. So you can imagine what people thought about this. They had no idea what was going on. Some of them thought she was making it up or it was psychiatric or something. But it really fit what is hemiplegic migraine or episodic ataxia. And these don't seem like, well, this is a weird diagnosis or so. But if you have a leak in a channel, a door in the membrane that lets a positively charged salt. Positively charged salts are cations, and I'm going to use that word a lot. What are cations? Sodium, potassium, calcium, magnesium. These are cations. If there's a leaky cation door or transporter and the cations leak in, when a cell is positively charged, it does its thing. A nerve sends an impulse, a gland releases hormone, a white cell releases, inflammatory markers, a muscle twitches, etc. So everything is hyperactive, and particularly the nervous system is hyperactive. And then these here are the three genes that are most commonly found. Mutations in these three genes are the most common causes of episodic migraine. Hemiplegic migraine. That just means one side of the body is weaker than the other, which Emma had. And episodic ataxia means that you have episodes of ataxia, which is like a baby or a drunk would walk. So you can see these are the three genes. There's calcium channel A1S, A1A, A1S, and the ATP1A2 pump. And here's her mutations. She didn't have a mutation in one of them. She had a mutation in all three, which is why her disease was really, really complex and severe, and no one figured it out. But this is found on DNA sequencing. Now, she had some return. She wasn't normal in any way, but she had gotten in February 2020, prior to doing DNA testing, she was kindergarten level in reading and first grade in math. And at that time, she was in seventh grade. So obviously, she wasn't like an infant anymore, but she was severely behind. And then she was put on treatment. And the treatment, except for one drug, it was all natural supplements. Mitochondrial cocktail. Because if you have a leaky channel, in this case, a calcium channel, it takes a lot of energy to pump the calcium back. And you need to give the mitochondria the energy it needs. And for this talk, I'm going to be talking a lot about mitochondria. Those are the part of the cell that make the energy. And the mitochondrial cocktail are the vitamins and minerals to make the mitochondria work better and to detoxify it, to get rid of the free radicals, reactive oxygen species, ROS, etc. So she was giving multiple vitamins and minerals. A cocktail means things mixed together, not alcohol. And potassium chloride, because giving huge amounts of potassium is a good way to exchange it. The potassium goes in, the calcium goes out. It's more complex than that, but that's basically what happened. And then the one drug I added is the citazolamide, which is used for altitude sickness, but it's also used for it's used for high blood pressure. What it does is it forces potassium into the cells. So I gave a lot of potassium, then I forced it into the cells to remove the calcium, and then I gave the mitochondrial cocktail to give the mitochondria the energy to pump the calcium out. And on that, the same test a year later, she was 8th grade in reading, which she was in 8th grade at that time, and 7th grade in math. Now, before all of this happened, she was always 1 grade behind in math. So she was back to her baseline. Said, okay, she was back to where she was, but she was sick for 3 years, and yet she was able to recover and to catch up to where she was. Her regressed behavior resolved. Her behavior became age appropriate. Her seizure-like events, the ataxia, completely went away. Her chronic pain, fatigue, and anxiety resolved. In fact, this is her now. She's applying for out-of-state colleges. I have to ask her where she's going to go next year, but she's going to go to an out-of-state college in September. She's completely resolved. She's not cured because if she went off of these, she would go back to where she was. But she is completely back to normal on supplements and one drug. And certainly I can't promise this in every single patient, but I've had others that have had this degree of improvement. And most of the patients do improve when you get the DNA and figure out what it is, but there's always some that don't. But this is to show you that, first of all, that cation transporters, or we call channelopathy. Opathy just means bad. Channelopathy is just bad channels. It sounds better in Latin. Channelopathy, or abnormalities of cation channels, is really important in autism and needs to be considered. But also that autism can be treated, and in many cases, and finding the actual DNA problem can be very helpful. So I'm not going to go into the study very much, but I just want to show that this is based upon hard science. This, by the way, is the machine on the right side. It's a HiSeq from Illumina. It costs $1 million. You can sequence the entire DNA in mother, father, and child in about 12 hours. So this is what I do, this type of machine. I don't have one of these, unfortunately, but I send everything to Variantix, which I have no conflict of interest with because I think they're the best lab. And they give me a DNA sequence, the entire sequence on the internet, and I go through it with basically with an AI. And then I look at a whole lot of things myself. So what this paper was, it was 100 patients of Dr. Richard Fry. You might recognize his name. They all had autism, and they were trio, mother, father, and I say child because I'm a pediatrician, but the children in some cases were in their 20s or 30s. And the study found that more than half of them had was a new mutation. What we call mutation would be a variant in the DNA. It's a de novo variant. That just means, again, in Latin, it means a new variant, a new mutation. And this is 1/10 of the patients in one of the tables of the study. But there's a couple of things I want to show you. On the left side is the gene that caused the autism in that patient. It's always different. In fact, in 100 patients, only one of the genes came up twice. It's not like, a few autism genes or something like that. It's always different. If I did another 100 patients, there may be one duplication again. It'll be another 99 genes we'll find. And these here are novel. That means, and this is the number of cases ever reported, number of cases, number of families, number of publications. No cases reported ever before. So each and every one of these is a new disease. And in fact, in the 100 cases, there were 24 new diseases discovered in those 100. And obviously, that's not going to show up in the lab report. It didn't. That's by going, because the lab only looks at genes that are well known to be established in autism. So it won't find the very rare ones either. Like this one here, the SETDA1 gene, there are 9 cases in the report. In 7 families, because sometimes there's affected children, affected siblings, and in 6 publications. So that one wasn't also on the report. And certainly the RAC1, there was only 1 case ever reported. The ones that will be on the laboratory report are the green ones that are known. You see, this one's just barely over 10. That's what I made the difference between very rare and known. And you see this one right here. This is a cation channel, by the way. And there's quite a few, 115 cases in the literature. So autism genetics is very, very complicated. Different genes, and many of them are not really well known because while there's probably about 1,000 autism genes known. I think in the Safari Autism database there's about 1,000. I suspect there's another 5,000 or more to be found. So what does this have to do with treatment? Well, these are the pathways. And by the way, this little code here that you saw and you're wondering what that is the same one here. This is what the code is. These are the cation transporters here. So they're in a red. So you see there were 3 of them here that were cation transporters. This is mitochondria, or energy metabolism, or redox, or having to do with reactive oxygen species. Immune system, and synaptic, neurotransmission. And then the cell danger response. Why are they bold, and why am I talking about those? Because those are treatable. Not every patient is treatable every time. You noted that this one was an Emma here in ion transport. But when I find these, I say this is probably treatable, and that's what I like to see. It's not that the other ones are not treatable. The green one here, sometimes I can treat that. That's protein degradation or breaking down old proteins. Sometimes I can treat the cytoskeleton and things like that. They just are harder to treat, and it really depends on the situation. So the other thing that this doesn't really show is this shows the major genetic component, but autism genetics is far, far more complex than that. The average patient has about 40 different variants in autism genes. I usually identify about 5, I think, or so that are very important per patient. So there's not just the main one that's de novo, that's a new mutation. There are the inherited variants from one or the other parent that often are more treatable. So this is the cations again. This is the transporter for the positively charged salts. And this is actually what one of them looks like. And then the calcium goes through where the P is right there. That's the pore. That's where the calcium goes. And this whole thing is really a door which opens and closes to let calcium in or to not let it, or to block it. And the mutations generally occur because the channels are leaky and too much calcium gets in, or sodium in some cases, in a sodium channel, and the cells are hyperactive. So hyperactive cells can predispose towards autistic behaviors, hyperactivity, attention deficit, anxiety, and seizures and migraine and pain and other things as well. Because if the cell is in the eighth nerve, which sends signals of hearing to the brain, you can get tinnitus or ringing in the ears if it's hyperactive. So it depends on which cell is hyperactive. You can get many different things. And the therapies are generally natural vitamins, minerals, things like that. As you can see, that some mitochondrial cocktail and potassium in the case of Emma, but different genes are different treatment. So these are some of this is information that I got mostly from Dr. Rosignol. You might, Dan Rosignol. And these are some of the nutrients that are been shown in clinical studies to have the most impact in autism. And this is what they do. So they are, like, these are here is involved in the mitochondria. This is involved in the mitochondria. Some are involved in methylation, neurotransmission. They do different things. It's just to show you that it's more than just a few pathways. There's several different pathways which are involved, and there are natural treatments which can affect those pathways. So getting to cations, because that's not something people talk about. There's a lot of supplements that will help, and there's a lot of medications that will help. And this really depends on what the channel is that's being affected. And I will give the mitochondrial targeted therapies are important because you need the energy to pump back whatever's leaking. And then potassium, magnesium, and zinc, you can see them showing up here. I use those a lot. And then if you want to affect serotonin, you can give 5-HTP. I use that a lot too. Medications, I'll use those occasionally. But I'll use them after I try supplements first. And if there's anything left over, I might use a medication, like I use acetazolamide in Emma, because she was much better, but I thought I could improve it as well. And when I put her on acetazolamide, everything went away completely. That was the last straw on that disease, as long as she's on treatment. But these are not to say that you throw these at the wall and see what works, but it based upon the exact problem in the patient. But not everyone can have DNA and have someone like me to go through the entire DNA sequence. And so things like mitochondrial targeted therapies, potassium, magnesium, and zinc, these are things that we'll often do on patients while the DNA is cooking, or recommend for particularly patients outside of the U.S. where they don't have access to the DNA testing, or they have access but they can't afford it. And that these are things that might help without knowing the genetics, because sometimes they do, and they rarely have side effects if you are careful about the dosing. So mito. You may hear people talk about what's mito. Mito stands for mitochondria, mitochondrial disease, mitochondrial dysfunction, etc. I stole this from the United Mitochondrial Disease Foundation. These are the manifestations of mitochondrial disease. So we're not talking about cation transporters now. We're talking about another process in the cell that can predispose towards autism, energy deficiency, or mitochondrial dysfunction. And you see that every cell in the body needs energy for everything it does. But it's mostly neuromuscular because the nerves are electrical and the muscles require, and that requires power for being electrical, and the muscles require power, obviously. So if you look at all this, you can see, well, a lot of them are neuromuscular, including like in the gut. Oh, the little GI thing got cut off here. But these are all GI problems, but it's because of the nerves or the muscles in the gut are not working as well. And then eyes and ears, that's nerve as well. But there's other things like kidney, liver, pancreas, that go to other things, but it's mostly neuromuscular, and it's because of the requirement for energy, the high requirements for energy. So people get confused about mitochondrial disorder and mitochondrial dysfunction. In both of them, the mitochondria are not working very well. In both of them, you don't have enough energy. In both of them, you have too many reactive oxygen species, and that damages the cell. The difference is in a mitochondrial disorder is genetic, and the effects are you don't make enough energy. Mitochondrial dysfunction could be genetic or environmental, and it could be on the supply side you don't make enough energy, or on the demand side you use energy too fast. Now, Emma had a mitochondrial dysfunction, not a mitochondrial disease, because her calcium channel leaks were causing her to have to use too much energy to pump the calcium back, so her cells would run out of energy. So it's the same thing if you're looking at your checkbook. If you make less money, you might bounce a check. But if you spend too much, you also might bounce a check. The same thing on both sides, supply or demand. And in autism, yes, there is mitochondrial disorders, and you do see things on the supply side. About 10% of autism have a mitochondrial disorder. But you see mitochondrial dysfunction 80 to 90%. And that's more environmental, but it can be genetic. And it's both, and it's on the supply and on the demand side. So at the bottom of the slide is really the baseline. If you have mitochondrial disease, of course you have mitochondrial dysfunction. But most people with mitochondrial dysfunction don't have a mitochondrial disorder. They either have a demand side problem, or it's acquired, environmental. So what do you do with mitochondrial dysfunction? You try to feed the mitochondria, and what does the mitochondria need? It needs energy, and vitamins and minerals do that. These are all vitamins and minerals which have been shown in clinical studies to help in mitochondria. In autism. They're deficient in autism. So if it's on the slide, and on my website, you can actually look at chromium, and it will tell you the evidence on it. You can look at selenium, it'll tell you the evidence. Either a study found that it's deficient in autism, or a study found that using this is beneficial in autism. And then the ones down here, there are no studies, but they do help the mitochondria. They help in mitochondrial disease, and I suspect that they would help in autism as well, but there's no studies in autism. So you can see when I say a cocktail, things mixed together, this is my cocktail. This is what I use, plus many other things that are not on there, because you just don't want to give some vitamins and not others. You want to give at least the reasonable amount of all of the other vitamins and minerals, so that you've optimized nutrition for all other cellular functions, because it's more than just mitochondria, as I've shown you. These are some slides from Dr. Richard Fry that show things like elevated lactate, elevated low carnitine levels, liver enzymes, and things like that. There are studies that show that they're defective in autism spectrum disorder, and then the numbers and everything. Particularly low carnitine was in 90% of patients with autism in one study. And that's why carnitine is often used. And carnitine is very important for energy metabolism. So there's a lot more to these than that. The one I want to show here is that mitochondrial function is particularly important for any developmental regression, a loss of milestones. And when I see a patient that loses milestones acutely, like within hours to a week, not like a gradual loss over several months or a year, but an acute loss. A week later, they're not the same person they were before. And Emma had that twice. It's usually either mitochondrial or immune or both. Those are almost always is one or both of those. And this is a study by Dr. Fry and others to show that those with autism disease that had a regression showed different. This is really, really complex. This is really how much energy you're making, and you're poisoning the mitochondria here. Poisoning the mitochondria would be like a situation of an illness or a vaccination or a major stressor, anesthesia, you name it. A stressor to the body, you're poisoning the mitochondria. So in the test tube, we poison the mitochondria, and then we look at it, and you can see that those that regressed are different than those that didn't regress and those without autism. And then here you can see that this is proton leak, this is leaky mitochondria. Those that had a regression are definitely different. Those without the regression are different than the controls, but not as much. And you can see that here, this is how much energy you can make. Of course, the ones for regression make a lot more energy, probably because their mitochondria are not working so well. And or their demand side even more. The demand side, they need too much energy, like they have a leak. As you poison the mitochondria, they still need more energy. So this is really showing is that mitochondrial function is, whether it's genetic or environmental, it's extremely important, and in particular during episodes of stress, like illness or vaccination, and it's more important in those that have had a regression. I like to show this to upset medical students. This is a slide of this is energy and metabolism. It's really complex, and you can't give one or two things. You really you need the cocktail, because you don't know what the genetic components are in the patient. And even if I look at the entire DNA, I'll miss things. There's no way that we can do that. So it's not just that it's complex, but it's an assembly line. So this is the Krebs cycle that came from, I think, one of my children's biology texts from high school or middle school. And this is the electron transport chain from the book. But this is what it really looks like. The colors are false, but this is an electron micrograph. This is an actual picture of the Krebs cycle and the electron transport chain crystallized on the inner mitochondrial membrane. Electrons go in one side and they come out on the other. It's an assembly line. This is an assembly line for the turn of the century. This is Ford. And this is an assembly line for the turn of the next century. This is Hyundai. So in addition to showing you what a century will do, if you give this guy his vitamins so he goes faster, you're not making more cars, you're going to have more chaos. Think about taking just this machine and making it work faster. You can't do that in an assembly line. You give them all their vitamins or all of them work faster, you can do that. And that's another reason why I am really against the idea of using one thing at a time. It has more side effects and it doesn't work very well. So I don't give huge doses of one thing. I give moderate, safe doses of a lot of things to move the whole thing. And I've been doing that now for actually almost 30 years. This is a vitamin and mineral supplement that was made by Dr. Jim Adams. You might have heard of him. He's in Arizona. This is the ANRC. Some of your kids might be on that. This is a competitor of the one that I make, just for everyone will understand, but this is an excellent product. And as Jim and I learned from each other's products, we made both of our products better. And this is just showing you before in blue and after in whatever this purple or magnetic color is, that everything got better after the supplement than before the supplement. I'm sorry, this is not before and after, it's placebo. Half of them were given placebo that looked and tasted and smelled the same, and then half of them were given the actual ANRC. And you can see that this is not a placebo thing, that it got better. And those that were statistically significant are the stars here. So while everything got better, we can say that the receptive language, hyperactivity, tantruming, and overall, and then the average were definitely statistically significant. But it seems like it went across the board. And this is what I'm seeing in general with this and with my and other supplements, is it really helps everything. Um, this is a trial that was this was written up by Zoe Hill, a student. She's now she's now a graduate student working for Dr. Adams. And this is on the neuro needs, spectrum needs, and Q needs. And this was Dr. Fry is the one that did this, and I only gave advice from time to time. I really had nothing to do about the decisions of this paper because I'm tainted, of course. We did it right. And this is the this is the 33 active ingredients that are in the spectrum needs: vitamins, minerals, mitochondrial cocktail, and then the Q needs down here. That's coenzyme Q10 and the ubiquinol form. The reason why this was separate is because coenzyme Q10, which is the actual electron carrier in the mitochondria, is critically important, but it doesn't go into the powder. It has to be in these little oil things. This is showing that maximum, and again, we're poisoning the mitochondria here. This is maximum ability to make energy. This is on the actual spectrum needs and Q needs before. This is in white cells that are been taken from the blood and then changed in the laboratory so that they can live long enough to do these experiments. But as we poison these cells, you can see that the mitochondria go down, the amount of energy they can make. This is the same children before and the same child afterwards. And this is all the children combined. And you can see that they make more energy the entire time. And they're not poisoned as easily. In fact, on full dose of poison, they're still making as much energy as they were before normally. This is reserve capacity. This is how much you can make on top of normal mitochondrial energy, that say to fight an infection or something like that. And you can see that as you poison it, of course, it goes down towards zero, the reserve capacity. But it's higher, and for a long time it stays up. And you said, well, this is on drug, but what on placebo? There's no change on placebo. And in this case, it's non-significant, but actually the placebo made them a little worse. But it's not that. It's just that this is within statistical significance. It's not significant. This is a pilot study. There weren't a lot of kids in it. There were only 16 kids in the thing. So the average is in the purple here, but each and every patient, the daily living score, you can see some of them went up dramatically. The average went up. And by the way, and that's on the actual supplement, and this is on the placebo, no change. Communication, there was an improvement. It was statistically significant. On placebo, they actually got slightly worse, but not significant. Socialization got better before and after, and then on placebo, it didn't change. And this is looking at all of it together, just taking all of this and putting it together. It made a big difference. This is, you say, it went from like 60 to about 70 or so. That's enough of a difference that you would see it in the kids. That's what we call a moderate effect size. It's not like they're suddenly cured, but they were moderate effect size. You would say, oh yeah, he's much better. And then on placebo, there's no difference. So you can see that, this one here didn't get any better, and this one here really didn't get any better. But many of them did get better, and some of them got dramatically better. These two here. You say, well, these are going in the wrong direction. No, you want less social withdrawal. And you get less, but on placebo, there's no difference. You want less inappropriate speech, and you do that, but on placebo, you don't. You want less hyperactivity, not on placebo, and you want less. This is all together, all bad behaviors. You want less of them, and you can see that. And then on placebo, no difference. So the take-home message to putting this all together is that TRIO, that's both parents plus the individual of any age, whole genome sequencing, WGS, as all of the DNA, can come up with a precise diagnosis. Half the time it was a de novo variant or a new mutation that wasn't in the parent. But there's a lot of other things that you can get from that. The inherited variants are important too, and they're often the treatable as well. So consider genetic testing in severe problematic or refractory cases. Refractory means they're just not getting better. And then I can see your child as either a consultant to your physician or as the actual physician by telemedicine. Um, and I only use Variant because it's the only lab in the world that really has the bioinformatics, the AI programming to be able to really do that. And it gives me access to all of it. But the other thing I want to show is that there's common pathways to autism. Energy metabolism and cation transport are primary pathways. I see those a lot, and they're very treatable pathways. But there's other ones that are I see too: neurotransmitters, neuroinflammation, and cell danger responses. Those are treatable too. Treatment is predominantly dietary supplementation. Yeah, occasionally it is drugs, but it's most often dietary supplementation. And there are combination products. I showed you one that's a competitor and one that a company that I own part of makes. And then, even if you don't have this degree of DNA testing, knowing that there are treatable pathways can help to know what kind of things to think about. Um, so I spoke a lot about mitochondrial cocktail. There's a lot more in the mitochondrial cocktail than this, but this is to try to make it easy to understand. Vitamins and minerals, many other natural things that don't really fit into those, but are energy cofactors, make enzymes work better. And then there's some things like creatine and arginine that don't fit in any of those, but they're all natural things. They're in all foods that are given at higher dose. So why can't you just eat well? Well, you need to eat well, and that's very important. But the dosing in a mitochondrial cocktail is sometimes a few times higher, and sometimes as much as 1,000 times higher than that you would get from eating a whole salad bar, basically. And you just can't get that dosing no matter what your diet is. And by the way, all of the dosing in both products and some other ones too, it's all safe. It's within they're all within what the federal government and the EU, the European Union, considered to be safe. We give a little bit more B12 than the EU is comfortable with, but people that give injections get like 100 times more. So I'm not worried about that. And it's their bioactive forms. They're methylated B12, methylated folate, folinic acid, which goes directly into brain, zinc picolinate, which is much better than the cheap zincs you'd get over the counter, et cetera, et cetera. So they're bioactive, bioavailable forms at high dosing. There are different brands, like I said, and they come in powder and in capsule forms. And inside the capsules are powder. I've spoke about coenzyme Q10. It's incredibly important. It's a good antioxidant, and it's also the actual transporter that moves electrons from complex 1 and complex 2 to complex 3. And so it's critically important. And then here's some stuff about Q. The thing is that most of the coenzyme Q10 that's sold over the counter is pretty much useless. It's in the ubiquinone form. You just need to give too much of it. Ubiquinol is much better. It's twice as expensive, so you don't see it over the counter, but it can be as much as 5 times more bioavailable. So it's actually cheaper to get the same blood level. There are many different brands of ubiquinol. Neuroneeds makes one too, but there are others as well. If it doesn't say this all over the label, it's the cheap one. It's ubiquinone, even if it doesn't say that. It has to say this all over. Sometimes the brands don't even really say CoQ because people are looking for ubiquinone. This is not omega-3 fatty acid talk, just to say that it's critical. You need omega-3s. It's critically important for health in general. People take fish oil. That's great for the whole body. It's good for the hair, skin, and nails. It's good for the heart, blood pressure, blood sugar. It doesn't cross the blood-brain barrier directly. And if you give a huge amount of fish oil, the brain only gets a little bit because you saturate the conversion in the liver. If you want to get a lot of omega-3s to the brain, it's got to be in a phospholipid form. So it's basically a crustacean like krill or certain types of microorganisms. There's a type of algae-like critter called schizocritium, which will make something that has, if you need a vegan or a kosher form. But I recommend omega-3s with either krill oil or occasionally with the algae type. But fish oil is good too. I really recommend having both of them together. Neurotransmitters. That's another pathway. I didn't talk about it very much. The nerve cells don't touch each other. The balance between the excitatory and the inhibitory neurotransmitters in autism is usually very high. So you're seeing autistic behaviors, attention deficits, anxiety, pain, nausea, etc., because the nervous system is or even migraine or in some cases seizures, because the nervous system is too high, too much excitatory, too low inhibitory. And there are things that we can do to change that balance, and that's mostly supplements, but there are drugs that will do that too. And then these are the supplements that I usually use. And then there's combination products again. This is to all of this increases the inhibitory neurotransmitters and a little bit decreases the excitatory neurotransmitters. But most of working in the excitatory neurotransmitters is mostly drugs, and the inhibitory is mostly supplements. I don't have enough time to go over Spencer's case. Here's my contact information. Oh, I'm sorry. Some of you might have heard that Karen was in my private practice seeing patients, and she died suddenly a week ago, and unexpectedly. Change that to Liz, Liz. I didn't notice that when I put this together. Liz at molecularmito.com. So we're a little bit in chaos right now, but we will try to get to you as soon as we can. This is to get to me. And if you're interested in NeuroNeeds products, it's here. And so far, I've given you the same kind of lecture I would give on a CME form, that it has to be completely devoid of all content that is commercial and it's balanced. But here are the sharks. So at this point right here, and I'm right next to the person taking the photo. So this guy right here is looking at me. There's actually friendly reef sharks. And when I talk about the mitochondrial cocktail, you can do it in, this is the NeuroNeeds form of it, a berry flavored or a lemon flavor in a powder, or for those kids that would prefer to have capsules, the energy needs. There are many different types of ubiquinol that are good, but the Q needs here has no soy. It's limonene oil instead, so it's lemon peel oil, and it does have better bioavailability than most of the other products out there. This is the fish and krill oil combination, because fish oil is good. It's great you can give high doses for the heart, and then krill oil gets to the brain, and the krill oil also brings phosphatidylcholine to the brain, which is important, and there's astaxanthin, which is a good antioxidant, and then I threw phosphatidylserine in there from sunflower seeds as well. So this is really like 3 different products in one. These are gel capsules, because there is no liquid krill product in the entire world. If anyone comes up with one, I want to figure out how they flavored it. It's just hard to get kids to take krill because it tastes like shrimp. It's basically shrimp. How do I get my kids to take this, my patients? Cut it open with industrial scissors and put it in chocolate. Dark chocolate, lots of chocolate. Chocolate has a huge amount of antioxidants. It's guilt-free, really. Give it to your kids. Good antioxidant source. And then the brain bundle would be one of these plus this plus this. So you can choose which of these you want, and then this and that. That's what I recommend for any neurodevelopmental disorder. And everything so far are things to to heal the mitochondria, heal the synapse, heal everything. And then the cell will heal itself, and then the brain will heal, and then the brain will reconnect, and then you can learn. That takes time. 2 to 3 months before you see major changes. At 6 months, you'll have more improvement than you did at 3 months. And you have to take it at full dose. You start low, go slow, definitely. But you have to be at full dose twice a day for about 3 months before you really notice that, yeah, this is much better. People that have tried for a month or people that tried half the dose or only once a day, that really doesn't do it. This one here, that's the calm needs. That has everything in it except for zinc because zinc often will cause stomach upset and everyone needs a different amount of zinc. So I'll usually do this and add some zinc. Sometimes I add more magnesium on top of it. But this is what I do to calm the kids down. I use this works immediately, like within 20 to 30 minutes. Most of my kids that take this in the morning because for school anxiety, social anxiety, test anxiety. So this does not sedate you at all. You can drive, you can do a math test on it. Of course, I wouldn't do a math test the first time you took it. I would take it a couple times to make sure because maybe about 5% of people are a little drowsy on it. And you need to find the right dose. 2 is the right dose for most people. Small, like a school-age child, I give 1 of them. You can open up the capsules and flavor them for younger kids. And then here's my information again, but please, send it to Liz. And I'll just leave this up for a moment. But, so it's up for questions. Sounds like there's a major problem. You can hear all the sirens over here.
Yes, thank you, Dr. Boles. Well, I just want to say, from a personal perspective, my son takes the Calm Needs every day. He had severe social anxiety. Anytime I asked him if he wanted to join a club or do anything extracurricular, he would always refuse. And since he's been taking the Calm Needs, he has joined Boy Scouts and baseball. And then my daughter cannot take pills, and so we use the Spectrum Needs as our multivitamin. And so we really enjoy your products quite a bit. Let's see. We have several questions. Let's see. We'll start with the first one, which says, given that Dr. Boles' expertise is in genetics, I would love to hear his thoughts on whether mitochondrial function can be improved or supported in a child with a genetic deletion and whether therapies interventions can help despite the underlying mutation.
Do you mean mitochondrial DNA deletion?
Oh, I do not
The person who
know.
the person who sent that can chat you.
Yes,
Yes.
please do.
Okay. All right.
C-
The
Um,
Spencer
yes.
who I didn't show you, he has a deletion. That's the one that I went through. It's too bad on that. Well, actually, let me go ahead and let's talk about Spencer. So the answer is yes, it can help. It's very difficult to treat these deletions. But let me see. Share here. So Spencer had a large heteroplasmy. That means it's not in all of them. There's some normal. If you have a deletion in all of your mitochondrial DNA, that you can't make any energy at all. The cell can't survive. So you have some with the deletion and some with not. The problem is that the deletion can increase over time. He had high functioning autism and had some accommodations. He had eye muscle weakness. He was found to have a deletion. He got severe in back and vertigo because you can get severe pain with mitochondrial problems. And then he had these crashes, of which they would last 1 hour to 2 days long. He would get 3 to 6 per month. During these crashes, he would be profoundly fatigued. He couldn't think at all. He couldn't do any homework. He was just lying down. I mean, he couldn't even watch TV really. And they gave him the diagnosis of conversion disorder, like he's making it all up, and right out of Freud. I mean, if we haven't learned anything since then, don't get me wrong, Freud was really revolutionary for his time, but we can get a little bit better than that now. Every time I've ever seen somebody with a conversion disorder, they have a channelopathy. I know someone will probably come up with one example or something. I think every time I've ever had somebody with conversion disorder, I made a diagnosis of channelopathy. And in Spencer, you go back to his DNA sequence, and he has a channel abnormality on top of his deletion. So that's what was causing that. And then he got the cyclic vomiting syndrome, which is episodes of vomiting, and then I put that in remission pretty quickly. on the medications, knowing which channel was involved. Um, you can treat it. I mean, Spencer's deletion is, everyone would have said, and they told him it's a fatal. It's fatal. You can't do anything about it. But that was Spencer is in his 20s now. He was diagnosed like 12, 15 years ago with, a fatal thing, and he's doing pretty well. He was in the hospital um, with pneumonia and was on life support and everything, and he got over that, and he's back to his previous baseline. So that shows that not only is he, pretty much stabilized, but he could go to death's door itself and come back. So I think Spencer's going to be around a few more decades at least. So yeah, you can do something, but it is more difficult to treat a deletion. I'll say that.
Okay, wonderful. Thank you. Another beautiful testimony. Our 26-year-old autistic son has been on one psych med after another over a period of 15 years for violent outbursts. These meds include risperidone, propranolol.
Hmm.
I might butcher these,
You
but
got it.
you'll know what I'm saying. Anafranil, Luvox, Abitify, olanzapine, lorazepam, Klonopin. These dosages were changed multiple times. He was also on Miralax while taking some of these meds. He's being weaned off Klonopin now, and we don't want him on any more psychiatric meds because they have not helped. I suspect they have made his problems worse. Can these meds harm the gut microbiome? If we don't consent to any more psychiatric meds, will the violent outbursts stop?
Okay. Um, I'm going to say two things on the onset, and then I'll go into this. First of all, I cannot give individual medical advice because I don't know your child. It would be, it's not only illegal and improper, I could do wrong. I could say the wrong thing. So I'm going to ask the question that may be very much more helpful to everyone here is violent outbursts, psych meds, what about them? And then the second thing is I really, email me after this. So, um, and I'd love to see your child as a patient. Um, so psych meds, they snow the behavior, but they don't fix the underlying problem. The cocktails, whether that's ANRC or spectrum needs or energy needs, you can see they fix the underlying problem. Social ability, language, behavior, they improve. You're not just using psych meds to snow the patient. Sometimes psych meds need to be given. You can see that I don't like them, and I only use them or recommend them when they absolutely are necessary. I try to get my patients off of them as much as I can, and usually I'm successful in at least reducing the dose or reducing the number. Sometimes I can get off of all of them altogether, as in Emma's case. But it, if you can't fix it. It's no cure. If you mitigate, if you improve the underlying problems, sometimes the behavior will go away completely. Another case I sometimes talk about is Ryan, where he had these episodes of violent behavior. Ryan is a really big guy and was severely damaging his family. And he was going to go on psych meds and be in an institution. And we all know that he would have been tied down with restraints there because he would go on a rampage and he was extremely violent. I found a channelopathy in him. I put him on high dose potassium and acetazolamide. His episodes went away. He hasn't had any. He's now been, for the last 8 years, he's in a group home. He works. He makes money. He lives with a roommate. Yeah, I mean, he has borderline mental retardation or maybe even mild mental retardation, but I mean, he's living his best life. He also had cyclic vomiting syndrome for like 10 years, and on to treatment, he hasn't had a single episode in 8 years. So, yeah, I mean, if you find the underlying genetic cause, it can make a big difference. And if you can't find the underlying genetic cause, I would assume it's a channelopathy and treat it as such because potassium, magnesium, zinc, mitochondrial cocktail, these things are not going to hurt. But speak to your physician because at least at the current time, I'm not the physician. I'm just some guy on Zoom.
Okay, thank you, Dr. Bowles. What are the ingredients for the mitochondrial cocktail?
Okay, let me share again. You didn't, I really didn't make these. You guys have the best questions. And it's like I made these questions and I gave them to you, but these are real questions, right?
Oh yeah,
You didn't make
in the
them up.
Q&A.
We did
Oh
not talk
no,
about this ahead of time.
these are real people that just
These are
listen to
real
your talk.
questions.
Yes.
Yeah, this is the mitochondrial cocktail. You can find this, I mean, it's in spectrum needs and energy needs, and then active needs, which I made for myself for people that are over 40. I might be a bit over. In fact, I'm 65 and I work 60 hours a week, and active needs keeps me going, but enough of that. Um, but this is the mitochondrial cocktail in my mind, and other people will put different, they may take one or two off and add one or two. But this is basically it, and you'll see that there's omega-3 fatty acids are in there. That one's not underlined because this one you have to take separately. And the coenzyme Q10 is best to take separately as well, but everything else is in that. ANRC has a lot of these in it, most of them, but not all of them.
Perfect. And on that note, this webinar will be on our website. So if anybody wants to go back and reference anything, you can go to our website, which is autismhealth.com, and you will see this video as well as all of our other monthly webinars. What are your thoughts on the latest discovery of DNA in vaccines and how this may be a source of this problem? Did Emma have a vaccine before her symptoms started?
I have a lot of case reports that show vaccine damage. I'm not afraid to show that and talk about that. And my name is only out there because I have testified in vaccine court several times. So the government already has me on their database. I'm a moderate on vaccines. My patients, for the most part, have been fully vaccinated. Why? Because I know how to do that in a way that doesn't harm them. Um, Very briefly, I wait till they're about 5 before starting kindergarten because the the um, the regressions don't happen after age 2. Occasionally up to age 3, but incredibly rare. And at 5, never ever. I have them on cocktails. I make sure they don't have a viral infection. I think that's a big part with the whole thing. You go into the pediatrician's waiting room, kids put everything in their mouth. They touch everything. They get a viral infection in the waiting room, and now they have an infection plus the vaccination plus Tylenol, which they're told to give, which binds glutathione, the main body's ability to fight it. You say, well, antioxidants, why doesn't the body make them? It does, glutathione. And if you use Tylenol, that's gone. I mean, so yeah, I think that if you do all these things and more, I mean, that's the basic stuff. It I have not had any of my patients have any regression whatsoever. I'm in California where you have to vaccinate, and we've been able to do it successfully and without any issues. But if you don't do it the right way, yeah, and particularly if you do it at a vulnerable age, things can happen, and they do sometimes. Regarding the DNA and all that, I'm not an expert in all that. My opinion is no better than anyone else's, and perhaps less.
Thank you so much. What specific forms of potassium, magnesium, and zinc work best when dealing with a cation,
Cation. Yeah.
CAT, yep, cation issue? Does it depend on the channel? Oh, right, the channels that we were talking about.
Yeah, I mean, it's, you know, most of the audience probably knows this, but some don't. Like, it's functional medicine, right? You can call it biomed. You can call it by many different names. It's the what MAPS does. If you don't know what I'm talking about, put med maps MAPS into Google, and you'll find providers everywhere. They do functional medicine. They do biomed. integrative. I'm one of these people. I'm actually one of the faculty for MAPS. Um, with these people, I mean, they're mostly cash because they spend an hour with you instead of 5 minutes, and they go through things. And the main thing they look differently is they look for the underlying mechanism. Why does your child have this problem, regardless of the age of the child? And then they try to do things about that. So magnesium in glycinate form I use most of the time, particularly for anxiety. If you have bad constipation, I'll use magnesium citrate. You'll hear 1,000 different things about magnesium. Magnesium is like a religion. Everyone has their own favorite, but that's mine. Okay. Zinc picolinate is best, but glucanate's okay. It's good too, because it's bioavailable in those forms. These people, these biomed people, they'll use zinc, they'll use magnesium. I always get an RBC zinc and magnesium levels, red blood cell ones, and I want them to be on the high side of the normal range, or even a tiny bit higher in some cases. So I'll use those. Potassium is more, and you're not going to hurt anyone with zinc and magnesium. What are the side effects? They're GI side effects. And I don't see that problem. If you start low, go slow, take it with a meal. And if you're using very high doses, get blood levels. Because, I mean, if it's higher than the normal range, higher is probably not going to help. Higher doses. Potassium's a more difficult situation. Potassium is so important. I mean, potassium is in fruits and vegetables, and particularly different colored fruits and vegetables, which also have different antioxidants in it. Different colors are different antioxidants. The antioxidants, which make the color of the plant, by the way, and the different antioxidants give different colors to our eyes and different antioxidants for the mitochondria. So I tell the kids to eat their colors. A high potassium diet is a good diet, and that you're not, unless you're have kidney failure or you're talking about your grandmother at age 80, yeah, talk to the physician before you load her with potassium. But a high potassium diet is a good diet most for kids and young adults that don't have kidney disease or are healthy. When you're using potassium chloride in prescription diagnosis, then you need a physician to prescribe it and to get blood levels and to watch it. And that's really a lot of information on itself. And I do that in states in which I have a license. So, by the way, I am licensed in California, Arizona, Florida, New Jersey, and Pennsylvania. That doesn't mean you can't take advantage of that if you're in another state, because I can work with your physician as a consultant anywhere in the world. And then people that are near one of those states will often drive in to consult with me by Zoom. And then and then for a year I can consult with them after I've done it in a state in which I'm licensed.
Very interesting. What does Dr. Boles recommend for a child who will not take pills and is very sensitive to tastes, textures, which often make liquids and powders a challenge as well?
There's two different parts to that. Um, if your child is over 6, 8, something like that, they can swallow. They just think they can't. At 10 or 12, you can get a child to swallow. Okay, there is. This sounds like a commercial. I don't have any money in this company, but I should buy some stock though. It's Oroflow. I think it's ORALFLO. It's a cup. You put the pills in it. The kids swallow the pills. After a while of doing that, the kids will say, "I don't need that cup anymore." Anyone who's age 10 or over, you should be able to get them to swallow. And I've had kids as low as 6 or so. Under 6 or so, you don't want to do it. So that's one thing, is get the kid to swallow, because it's so much easier. Everything, your life will be much better if you can do that. The second part of that is if they'll take chocolate, that's the answer, because it has a lot of antioxidants in it and it can mask anything. The second one would be a very concentrated fruit like cherry or something like that. Like you can buy the concentrate. You can even get grenadine. It's used in alcohol cocktails. Grenadine is really strong, and yeah, it's got some sugar in it. But I mean, you can wean that off later. But it just needs something that fruit juices. Again, you're talking antioxidants. You get some sugar in there, but you have antioxidants, so consider it a wash. Oh, and there's one other way. There's the way I got my own children. I have four of children of my own, so I know what I'm talking about. I can use the dad voice and everything. I told my son at age 10, I said, the GI system has two doors, and I really don't care which one I use. And he didn't believe me until I put the KY on the glove, and then he said, no, 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 I'll swallow it. From that point on, never had another issue. True story.
There you go. Yeah. Okay, my son is 18 and level 3 autism. We have tried so many supplements under supervision of functional integrative doctors and psychiatric psychiatric medications, and my son is still delayed. He cannot sleep, sometimes 3 to 4 days without sleep, and doesn't show that he is tired. Constant loud vocal stems and constant body movements. He regressed at 18 months, lost speech and eye contact. Therapy and ABA private school didn't help. Please, any advice on what to do?
Okay. Um, Again, with the caveat that this is not direct medical advice other than email me and get an appointment. That would be my advice. Um, the sleep, there are five things to good health. And you say, oh, well, this is just, why is he talking about this? Because good health is mitochondrial health, because the mitochondria make the energy for the body, and most toxins affect the mitochondria. Most problems affect the mitochondria. Diet, exercise, sleep. I'm going to get back to that in a moment. Toxins, like smoking, alcohol, and other toxins that are out there, and stress. That's the big five. If you can address the big five, you'll you're whoever it is, you'll be your best self. So your child may not be fixable, and most are not, but he can be his best self, and those are the big five. And sleep is one of them. And that type of sleep is going to cause psychiatric problems in anybody, regardless of their genetics. And somebody with that type of sleep has probable genetic abnormalities as to why their sleep is that way. Whether they can be found or not is another story, but often I can. Maybe half the time I can find the genetic reason why the sleep is off. Um, and the mitochondria may just be that reason because the clock genes are in the mitochondria. And when the mitochondria are toxic, they affect the clock genes. And so fixing the mitochondria, you can't fix it. Improving the mitochondria might be the source. So I would say is that genetics is very important. Sleep is dramatically important, and mitochondrial function can be improved and can help sleep. So I think that's a really good instructive thing because you have to think about the big five. I mean, you probably everyone's has their one or two or three of those they're thinking about and saying, oh yeah, my kid doesn't exercise or my kid doesn't sleep. Biomed really handles the toxin one. You got that one down probably. The stress one, you're working on that. And that's lifetime work. But and you're working on the diet. But think about sleep and exercise. Those are big things to work on too.
Thank you. Um, Okay, so let's see. What are recommended alternatives for kids with fish or shellfish allergies and Crohn's disease that make certain ingredients in the neuro needs an irritant?
Um, the oil has almost no protein in it. It shouldn't be a problem. Now that being said, shouldn't be is 98%. If you take the neuro needs, omega needs, and you cut it open, and you take 1/50th of it, in other words, the tiny little smidget, and put that in something, and there's no reaction, then take a larger and a larger amount. I think that you can take the whole thing, and if there is a reaction, it's not going to be deadly at all with a tiny amount. Most the oils are not going to be an issue. There shouldn't. All of the things that I make have basically no antigens in it. I mean, there's nothing in there that's going to affect that. But again, that's a 98%. The 2% or so will react. But start low. In this case, really low. Go slow, quite slow. If you're already taking a quarter of it and there's no problem, there's no reaction. You don't need to go up any slower after that. Um, I hope that that works for most. If you're talking MCAS, mast cell activation syndrome, maybe 20% of you have that, or your kids have that. That makes it very difficult. Fixing the mitochondria can often help that because the white cells, if they leak calcium or sodium, will make the white cells hyperactive, and you get mast cell activation. I've had several MCAS patients, so their MCAS went away entirely on supplements. It's not always work. But you see, the problem is they can't take the supplements because of the MCAS, and they need the supplements for the MCAS. What's the answer? 1% of the dose, and then work up slowly over months. That usually works, but not always.
Wow. Um, okay, so the person that asked the first question about the deletion
Uh-huh.
said no, a rare deletion, not mito specific. So,
Oh, every deletion is different, and so that's really it.
mm-hmm.
There's 23,000 genes, and a single gene can have many, many different deletions in that same gene. So it's really, I can't answer that question other than to say that
Yeah.
there's a genetic mechanism there, and a genetic deletion might be normal. It may be the cause of disease, and it may be a risk factor contributing toward disease, but not the main cause. And there may be other ones in there as well that haven't been found. Or there may be treatable factors that are not the main thing. Maybe the deletion is 50% of the disease, but there are genetic factors that make up, another 10 or 20% that can be identified that treatment makes a difference. It depends on which genes are deleted. There's 23,000 genes, and a deletion could be any of them. I don't know.
What are your thoughts on mitochondrial function testing, like the mito swab, even though there's not much research on it to track progress?
There's really nothing on that. That's true. This is where it gets into the art. 90% of what pediatricians do is art. It's based upon what they learned, what worked, and what the colleagues do that they respect, what works for them. That's what art is. And the science is 10%. And when I think of myself as a physician and a scientist, but I'm a physician first. Treat first. But the science informs my treatment. And MitoSwab doesn't have a lot of science behind it, but there's some art behind it. That it helps me. Let me give you some examples. I don't recommend it all the time, and it costs a few $100s or so. But if it comes back normal, which it rarely does, then I double down on everything else, and don't think about the mitochondria as well. It doesn't mean the mitochondria things are not going to help, but I really start thinking, what else is there? When the mitochondrial test comes back very abnormal, like really, really way out there, then I say, okay, energy needs, spectrum needs, Q needs, that's not enough. We have to start using N-acetylcysteine, NAC. We have to start talking about flavonoids. I may increase the vitamin C or the riboflavin or something like that, depending on what it shows. Is complex 1 low? Is it complex 4 low, etc.? So it can give me some information that can be helpful, but it doesn't give me a diagnosis. And sometimes it's like, oh yeah, the mitochondria are a little bit abnormal. That's kind of what I thought. Doesn't tell me anything new, but at least it's sort of contributory. It's sort of like, okay, you're on the right track.
Mm,
So I often recommend it, but it's not pivotal.
okay. I proposed to use PQQ and
Uh-huh. Okay.
Euro, yeah,
You got it
urolithin
close enough.
A, uh-huh, thank you, for mitochondrial synthesis and recycling. Any thoughts or comments?
Yeah, this is two of the three things that people are talking about now. PQQ. My patients never benefit from PQQ. Why? Because they get the right type of CoQ at the right dose, and if their blood levels aren't high enough, I give it higher and check the blood levels and I like the level between 4 and 7, which is higher. Normal is like zero point 0.5, zero point 0.6 to 1.4. I like it quite high between 4 and 7. When people have enough CoQ in their system, really high dose CoQ, PQQ doesn't seem to make that much difference. I think that PQQ has been really helpful in people that just can't get the CoQ inside because they can't get the level high enough because of really bad GI disease, or they're just not on enough CoQ, or no one's checked the level and it's not high enough. So I don't use it, but I can see it could be useful. The urolithin A pomegranate husk, it's digest in the stomach. Well, the bugs or our flora, our microbiome in our gut will make urolithin A. So it's natural, but it's made by microorganisms in our stomach. You can make it yourself by eating a whole bunch of things like pomegranate husk that the bugs like, or you can just take it as a capsule. Um, I don't have a lot of information on how useful it is. The other one that people are talking about is epicathin. It goes under the name mitocatalyst. Um, so just the usual spelling of mitocatalyst, but with a K instead of a C. It's very expensive, and I've had some cases that kids got better on it, and others in which they didn't. But it actually is a plant product which helps the mitochondria make more mitochondria, and I'm using that on my most difficult cases now to get more data. But right now, I've only given it in two patients. Well, two siblings. They're twins, and then one adult female. The two twins got much better, and the adult female didn't get better at all. So 2 out of 3, 1 out of 2, depending on how you measure it. So I'm trying to get more on that. But that's another thing. And all 3 of those are not in my products, but things to think about.
Could you please speak to mitochondrial dysfunction incited or exacerbated by environmental triggers, heavy industrial and agricultural pollution, exposure to fungal endotoxins, and medications?
Toxins can affect the cell in many different ways, but many of them affect the mitochondria preferentially, or that's where the action is at. Everything from air pollution to microplastics to things in our environment that look like hormones to heavy metals, pesticides. I can go on and on and on, but all of those are mitotoxins or can be mitotoxins. And the action of where they're causing damage is often in the mitochondria. And I mean, everything is genetic and environmental. There's no exception to that. Okay, you say a broken leg, that's environmental, not genetic. No, because people with certain genetic factors are more likely to be daredevils, and people with certain genetic factors are more likely to have bones that are demineralized. Okay, we'd say, well, Down syndrome, that's all genetic, right? No, you can have 2 twins with Down syndrome. One has much more retardation than the other, and they're identical twins. And that's obviously it's got to be environmental, and treatment makes a difference. And Down syndrome, actually, treatment makes a lot of difference sometimes. I use mitochondrial treatment in that, by the way. But anyway, so everything is environmental and everything is genetic. Is finding the right balance. And as a geneticist, obviously, I'm focused on one side of the equation, and a lot of biomed people are focused on the other side of the equation. I'm not saying environment is not important and removing toxins from the environment. I'm just saying, balance it. Think both. Do both. Look at the environment, but also look at the genetics, because you're not going to get rid of all the toxins. There's no way. And think about what genetic mechanisms there might be to break down the toxins. And the mitochondria is a major part of that. Good mitochondrial health is good, it's good for toxicity in general for whatever's out there. So that includes everything from diet, exercise, sleep, stress, as well as avoiding toxins, of course. And then on the diet side, the supplements to help that out beyond what you can do with food alone.
We had a WES and a CMA done. Results showed no variants detected. Are we able to take a copy of the raw data to other providers, such as yourself, to see if any genes were missed? Or are there other genetic tests that we should be looking at?
Well, I tried doing that, and I tried doing that for a few years, and there were too many false positives. There were too many that I found things, and then we did more testing later and found it was false. I'm not saying that the major labs give errors. The major labs give errors maybe 1 in a million or something like that. But when you're looking at 3 billion nucleotides, you can see the problem. When I looked at whole exome sequencing, that's all 23,000 genes, WES, there were too many false positives. If you go to whole genome, there are way too many. The only way that I can find out if they're false positives or not is to look at the back end of the computer and look at the real raw data. The raw data 95% of the time will tell me if it's real or not. Yeah, there's some gray. I'd say maybe 2% is gray. I'd say 98% of the time I can look at it, I can say, 100% this is real or not real. And 2% is gray or something like that. But without the looking at the back end, it's called IGV. I can't do that. I can't do IGV because it requires a lot of software and a supercomputer and a fiber optic cable, none of which I can afford or have. So I can't do any of that. And I find that in any rate, I only use variantics whole genome sequencing because it does the whole genome, which will redo the CMA much better than a CMA that you would have gotten. It looks at the exome. It looks at the other 98% of the DNA. And it will look for pharmacogenomics and everything, so you can see what variants are there that make a drug more likely to be broken down faster or slower, et cetera, et cetera. So it does everything. The price is an issue. In a child on a PPO or Medicaid, with an autism code, usually we can get that covered. Even if they had other sequencing, maybe a problem, maybe not. It can usually be covered in the United States. If it's the other genetics that's been done more than 5 years ago, definitely can often be covered. It's a little harder after age 21. It's a little harder in ADHD than in autism because they don't see the need for it. And if some HMOs can cause a lot of trouble because you have to use their lab, and their lab is not it's not useful. But Medicaid and PPO usually is okay. And some HMOs, half the time we can argue them down. If that's not going to work and you have to pay cash, Variantics will do a whole trio, both parents and the patient, for 2,100. I know that's a lot of money, but it used to be 10,000 to do far less DNA. And the prices have not come down in the last few years. They've been pretty stable. I don't think they're going to go up or down. I think that that's pretty much the price point.
Okay, thank you. Do you have a recommendation or are you aware of researchers focusing on mitochondrial, autism, ADHD, and women's health due to hormonal changes? For example, progesterone can negatively affect ADHD and potassium.
That's all true, and I know nobody in the world working on that. But I have not looked to see if anyone is or not, but I don't know anyone. But hormones make a difference. Hormones do turn on mitochondria. And,
Right,
well,
right.
I mean, let's just face it, puberty is difficult on everyone, regardless of the circumstances. And puberty is even more hard on neurodevelopmental issues. And it does affect the mitochondria. Those hormones do kick up the mitochondria to another degree. The growth spurt, all of that.
Hmm. Okay, Krista Bourne, who is our secretary at our 501c3 Autism Health, has put in the chat, actually not a question. I just wanted to thank Dr. Boles and share that this webinar and previous expert recordings can be found at monthly webinars under our services tab at autismhealth.com. I want to share how much my non-speaking, previously self-injurious slash aggressive 27-year-old son has benefited from Spectrum Needs powder, drink mix, lemon or berry, omega needs, and Q needs. Previously fight or flight, sleep deprived with constant fatigue. As an autism mom, I absolutely love active needs. And I will say I love active needs too. So if you do just want to say one or two things about active needs, Dr. Bowles, I think it would be
Oh,
nice.
okay. First of all, and this is completely true, I made active needs very selfishly because I'm 65 and I don't like, I mean, I was on energy needs and that was great. And I said, I feel younger, but I'm getting older again. I need to up my game. So I made active needs, which has all 40 ingredients in energy needs, but it also adds a lot of arginine and citrulline to open up the blood vessels to more blood to the heart, the brain, the muscles. Bodybuilders often use those to get more to the muscles, the heart, and the brain. I also put 10 herbs that have been used for thousands of years in China and in India for help with exercise, to make you feel younger, to increase your focus, to fountain of youth type things. You go to an Eastern practitioner, and in California, there's a lot of them, and I've gone to them before. They've got some herbs that can really make a difference. So I threw those in there. And then I put some things in there to slow down the aging process, like resveratrol, nicotinamide riboside, which is a type of B3, etc. So I don't use it in kids because they have to age to grow up. So, and when they're fully grown up, I'll use it. So I use it in anyone over age 40 that's starting to feel their age. And a lot of autism moms and dads out there are, chasing their kids, and they need some more energy. I also use it for chronic fatigue syndrome in adults. So that's what active needs is. It comes in a powder because otherwise you'd be taking not 10 a day, but you'd be taking like 40 capsules, and no one's going to do that. So it's blood orange flavored. So I just took my active needs before getting on this.
Beautiful. Does inflammation affect mitochondrial function?
Yes, it goes both ways. Everything in the body affects everything else. So any two things. But yeah, I mean, the mitochondria inflammation can affect the mitochondria, and mitochondrial dysfunction can kill cells. And cells that are dead will have their inner parts related to the immune system, and then you have inflammation. It goes in both directions, and anti-inflammatory things. That's one of the 5 treatable pathways. Omega-3 fatty acids are really important for inflammatory things. Many of the vitamins and minerals that are in the combination products, we call it a mitochondrial cocktail, but it really hits cations, neurotransmission, and inflammation, and it also hits the cell danger response. So it but inflammation goes far beyond that. Some I'd say about 1 in 5 of the patients, I find genes in the immune system, and then I send them to a research immunologist to say, okay, here's the mutation, here's the gene, what can you do about it? And also in the 10% or so that I find nothing in the genetics at all. I mean, sometimes the genetics is clean, I can't find anything. It could be just what we don't know, what I missed, but I assume it might also be immunological, so I send them to an immunologist to see if that might be what's going on. So I know that went off topic a little bit, but yeah, they are related, that they interact with each other. All of these interact with each other. And again, think combination. If hitting many different things is much better than hitting one of them really hard in terms of factors for a disease.
Right, right. Okay. My son was on several of the supplements that you mentioned during your presentation. Is it possible that the psych meds he was taking may have interfered with the supplements?
Well, they're not going to interfere with the supplements, but they may be interfering with your noticing the supplements are working. Because if you're, I know I've used this word before, I am biased. If you're snowed on psych meds, um, you have more energy. How do you know? Kids snowed. I mean, these drugs have their point, and some kids or adults absolutely need them. But I prefer to use less drugs, less dose, less of the time. And often with supplements, you can get there, but not always. So I don't know your exact child, but I would say the psych meds may or may not be interfering with noticing an improvement, or there may not be an improvement. I mean, realistically, about 80% of kids benefit from this stuff, and it's maybe 65 or 70% in the adults. It's more than half of the adults. It's worth trying, but it's not all of them. So, overall, it's about 75% will benefit from the full dose at twice a day for 3 months, but it's not everyone. There are failures. Treatment failures sometimes tell me, look what else there might be. Look at the rest of the genetics very carefully. What else is going on?
Hmm. Um, have you looked at a product called astaxanthin from red algae? It comes in dark chocolate. Valasta is supposed to help with autism.
I got the astaxanthin. That is in naturally in the krill, and it's in the omega needs. It's in any krill product naturally. The other part I didn't get. I don't know about that product.
Okay.
Astaxanthin is a good antioxidant.
Mm,
The more antioxidants, the better, because you can give all you want of one antioxidant and you get a plateau. So there are, maybe 20 antioxidants or so in spectrum needs and energy needs, and you add another 5 or 10 in active needs. But then you have other antioxidants you can get, like NAC and things you can get from chocolate and foods. Different colored fruits have different antioxidants. There's a lot of things out there, flavonoids. There's a lot of, so just antioxidants are really important.
right. Absolutely. My grandson with ASD, non-speaking, is allergic to citrus, especially lemons, tangerines, and oranges. He breaks out in a rash. He even reacts to being around cleaning products with lemon. Which product that you talked about does not have citrus?
Well, the berry flavored spectrum needs does not have citrus. The I don't the actin needs does, and lemon does, and Q needs does. So it would say that that would be berry flavored spectrum needs, energy needs, and omega needs have no citrus, and then calm
Mm-hmm.
needs as well.
Mm,
So the ones that would be a problem are the limonene oil, which may not be an issue because it may be reacting to the proteins in citrus, and the limonene oil may not be a problem. That's in Q needs. And then I think there's natural lemon flavors in the lemon spectrum needs. So those are the ones that would be potentially problematic.
okay. Um, okay, so I think this person might have asked you the question. Let me go back up. Um, about the mito swab, or maybe this is a new question. Okay, so mito swab. How low is concerning as my 18-year-old's results were 23% in class 1 and 4 with 198% of mito? We're going to start treatment and have neuro needs as well as COQ10, but we haven't started yet.
I would say that fits into the category I said before that the test is abnormal. It shows mitochondrial dysfunction, but it's not extraordinarily abnormal and it doesn't help that much. What I mean by it doesn't help that much is I just assume that 80 to 90% of people anywhere near the spectrum have mitochondrial dysfunction, and that patient is one of them. So at least it gives you that information. You have the mitochondrial dysfunction you expect to see. Beyond that, not that much.
Hmm.
And again, that's a
Um,
general interpretation of that mito swab, not knowing your child. So I can't say that is has relevance to your child.
right, right. Okay. Um, let's see. I think we have a couple more questions. We're getting down to the end. Thanks for
Okay.
spending so much time with
Oh,
us,
no
Dr.
problem.
Bowles. 4-year-old autistic with whole genome normal. Do you recommend that for the parents to test to identify de novo?
Oh, yeah. Whole genome patient only likelihood of finding an answer is maybe 10 or 15%. Add in de novos, you're up to maybe 25% from 10%. De novos and me looking at the sequence, you're 75, 80%. So, yes.
Great, great.
And why am I
Um,
so special, whatever? Because I look at the whole thing. I look at the entire sequence. And I showed you all of those new diagnoses. The lab can't do that. They would lose their credentials if they did that because that's investigational. But I'm a
Mm,
scientist. I can do that.
right, right. Are there any recommendations for a kid with multiple exotosis and ADHD? We have found research now suggests a significant biological link between HSPG deficiency and HME and autism spectrum disorder. We found heparin sulfate in skin care products, and it works great where other skincare were not working.
I can't really answer that question with multiple exotoses because I haven't looked into that for at least a couple decades. Um, but I do want to mention one thing. We haven't really spoke about ADHD, which is a huge, big problem. Um, Probably 90% of people on the autistic spectrum have ADHD, and it is a separate diagnosis. What autism is that the social communication parts of the brain are not working as well as they should be. So in high functioning autism, they may be working normally, but the kid has an IQ that's in the 99th percentile. So relatively speaking, it's low. And with somebody with developmental delay, mental retardation, all that sort of stuff, it's really across the board, but you call it autism and the social communication is below that of everything else. So social communication is one part of the brain. Executive function, which is ADHD, is another part of the brain. If something's going to affect one, it often affects the other. Most people with ADHD do not have autism, but most people with autism do have ADHD because ADHD is the most vulnerable part of the brain, the frontal lobes. So treating ADHD is important in autism because it's a separate entity to some degree and it has separate treatments. Now, the genetics is the same, so a lot of the treatments I would do would be the same, but the treatments that are symptomatic would be different. So I just wanted, and there are the products that I'm talking about are very helpful for ADHD as well. And but if you just have ADHD and nothing else, people don't want to take autism products and they don't want to spend the money and they don't want to take 10 capsules. I understand that. So I have one that is called Focus Needs. There are two components, one that goes in water and one that goes in oil. They do not mix. So you have to take one capsule of each in the morning and then one capsule of each in the evening. The oil one is omega needs. This is exactly the same. It's just labeled different. The other one is similar to energy needs or spectrum needs, but it has much less in it. It's the one I put in the stuff that's most important for ADHD. So it's some people have used it as a cheaper step down product for autism because they can't afford the better stuff. But mostly it's, or if someone has just mild autism, they think that that's enough. But mostly we use it for either ADHD or for people that don't have ADHD, but they're, let's put it this way, it's not normal to be on a computer 8 hours a day. That's not the way that we were designed. And an average person may find that their focus is lacking and may want to take the product even if they don't have a diagnosis or even if they were tested, they wouldn't have a diagnosis because they're in the average range. So that's something to think about for ADHD would be the focus needs. It makes it easier. Just take one of each in the morning, one of each in the evening, and the price is less, a lot less.
Wonderful. Thank you. What would you recommend for weight loss control caused by psych meds?
Oh, that's kind of outside of my area. I would say work on nutrition and on exercise and on stress and on supplements to get on less psych meds. But that's outside
Mm,
my area.
right. If possible, could you speak about growth hormone and pituitary hormones elevation and treatment in mitochondrial and autism disorders where there are growth extremes, short, tall, and fatigue?
Okay. Well, fatigue can be caused by almost anything because fatigue tells the animal to curl up in a ball under a rock and heal and not go rushing after food or mates. So everything will cause fatigue, and mitochondrial dysfunction certainly will do that. Growth is really, really complicated because you're talking about weight, you're talking about height. There's many different things that will impinge on that. One of them would be growth hormone deficiency. Growth hormone deficiency is an endocrine or hormonal disorder. Hormone cells are in group 2 for mitochondrial disease, mitochondrial dysfunction. Group 1 is nerve and muscle. Group 2 would include endocrine glands, hormone glands, including the pituitary and white blood cells. So you get immune deficiencies and inflammations and stuff. This in tier 2, group 2 for that. So growth hormone deficiency could be due to mitochondrial disease or mitochondrial dysfunction, but it could be completely separate. So anything more would be a specific question that is giving medical advice, but that kind of is a generalized look at it.
Okay, and the very last question is very appropriate because Dr. Bowles, would you mind putting the slide up that has your websites and your email again? Um, just for people that are interested in reaching out to you. So please feel free to take a picture of your screen. And the question is as
Except for
follows,
the fact it's not Karen, it's Liz, Liz. I wish I would have saw that
right? We are so
beforehand.
sorry for your
Yes,
loss.
that's yeah.
Um,
Karen
thank
is a
you.
Mito mom, and I've known her for over 30 years. Now, it's a major loss for the community. She did so much.
Yeah, yeah. Okay, so the question is as follows. To get the gene testing done for parents and children, is that info on your website?
Email me or email Liz and say who you are and what you want. What would be helpful is the age of the patient, the and the state that you live in, and if you're willing to travel, because that will give me the options, and that you're interested in DNA testing, and then we'll see that we'll see that you get the information that you need to go forward.
Absolutely.
And bear with us a little
Um,
bit because Karen died 9 days ago, and she used to do all of that stuff, and so we're trying to figure out how to survive without her. If
I'm sure. Tragic
email
loss.
me if you don't get a response within a week.
Okay. Okay. Neuro Needs generously offered a 10% discount on all products to all attendees at the Autism Health Summit and is now offering a 10% discount using the coupon code Hope for Autism. So please feel free to utilize that when you go to their website, Neuro Needs, if you would like to source products that way. And thank you again, Dr. Bowles. We're so grateful that you spent all this time with us. Actually, that's the last comment. It's from Anna C. She said, "Thank you so much for taking the time and for the very helpful answers to our questions. Thank you."
You're welcome.
And this webinar will be on our website, autismhealth.com. And please feel free to sign up for next month's webinar as well. As always, thank you all for being here and have a wonderful holiday weekend. Bye, Dr. Bowles.
Bye. That was almost 2 hours, a little bit overtime, but I hope we covered everything. I really, yeah, do give that link to Chris because I do want we'll bring people to your organization.
Absolutely. Thank you.
Okay.
We appreciate
Okay.
the collaboration.
Oh, you're welcome. However, however we can collaborate. Chris is the guy for the. I'm the science and the medical guy. He's the business guy. So, however the two of our organizations can collaborate, that's great.
Amen.
All
Appreciate
right.
you.
Okay.
Bye,
Bye.
everyone.